California, and I want to show you this patient because I saw him exactly 1 year ago, and you can see significant improvement of his temple scars. So I'm going to go over that. I'm going to let a few more people join us tonight. But for those who don't know, I'm Dr. Qazi. I specialize mostly in scars, not just acne scars, but surgical and as well as acne scars, keloids as well. I also do acne, and I also do a lot with hyperpigmentation. So I do a ton of that. And you can see for this patient, I worked on his temples. It's actually something that a lot of people complain about. And it's something that I think that there weren't too many great options before. So I love the fact that here we have a progress report here. 1 year later, you can see significant improvement of the patient's temples. He's super thrilled with his results. And then when he came in, I ended up doing some more TCA Cross and Bellafill for him. So this was after a single session that I had done last year. And in this case, I actually didn't do any laser for him. So what we did was actually we did Bellafill, we did Subcision, and we did TCA Cross. You can see that improvement of his temple area. I think it's amazing, amazing progress right there. I hadn't seen him in a year. So he had actually, hi Joey, how's it going? He had actually set up an appointment just to do some more TCA, more Bellafill. Really happy to see, like, it's just his scars look great. So that's what I love to see. Actually, honestly, it's like it's a great process. I'm waiting right now for more people to join us because it's lagging a little bit on Instagram. So joining us right now, everybody who's just coming on, I'm Dr. Qazi. I'm over in Newport Beach, California, and I specialize in skin restoration, really. So I do a lot with collagen. I do a lot with scars. I also help with acne and pigmentation. Appreciate you guys. Appreciate everybody who's saying great results. Robbie's saying, what's a good face cream with no niacinamide or HA? What are you trying to solve, Robbie? That's, I guess, the question here. But yeah, take a look at this. This is 1 year after. It's really cool, actually. I didn't realize it was literally 1 year on the mark. And this is after a single session 1 year later. So he definitely said, you know, it got better over time. It gets better over time. That's the thing, is that like initially it's improved, but over time, the collagen response occurs over 6 months, 12 months later. And you start seeing the scars get softer, and that's really, really nice to see. But there's still a little bit of volume loss there, so that's what we ended up solving. So for something like this, the treatment like this is usually about between $3,000 to $5,000 for something like this, typically. Let's see here. This was with Subcision as well as Bellafill and TCA Cross. In this case, I didn't do laser. And I'll tell you why, actually, I didn't need to do laser for him, because I pay attention to the way, first of all, where the scars are located. This patient's primary issue was the temples. So a lot of times you can't really do as much with the laser in the temple as you could in the cheeks, for example. And so when I looked at it, I was like, not really going to be able to solve too much with doing it in the temple, doing laser in the temple. So instead, I did TCA Cross, and I did Bellafill, and I did Subcision. And so that's what you can see. You can see a really, really beautiful result there under that single session like that. Last year, 1 year ago, we did that. Really cool. I love seeing these kind of progress reports as well. So it's like just to kind of see what the process is for these patients. It's like it's a fun thing to see that full journey. Yesterday, I showed you a patient with an excellent result just 1 month later, and take a look at this now. So this is 1 year later. Beauty Blondie saying the pigmentation cream is very irritating. Can I use aloe, which is better, Vaseline Aquaphor? You could do actually Vanity cream. Actually, it's totally fine. Vanity cream is okay. No, it's typically about $3,000 to $5,000 for something like this. This is basically Bellafill plus TCA Cross Subcision, so it's probably about $3,000 to $5,000 for patients, depending on which areas we have to do it and how long it's going to take us. So typically, it's about that. Let's see here. So Mika's saying, you here, are the results permanent? Yeah. So good question. So you will get to keep your skin. 20% of the Bellafill continues to stay there. You can see, again, this is actually 1 year later. The Bellafill looks amazing in that area, in the temple area. It's beautiful. And so it does actually stay there, and it continues to continue to support the scars and provide a scaffold for the scars. But that being said, You have fat pads that are there otherwise. And as you get older, let's say you're somebody who's a marathon runner. I'm not a marathon runner, but I have marathon runners as patients, and they have really a lot of temple hollowness a lot of times. You'll see that their temples could sometimes get quite hollow. So for patients like that, we may have to do more adjustments with more Bellafill, for example, in the future, or Sculptra. Sculptra is another option in the temple. How is tretinoin 0.1%? A little bit harsh. For patients starting. I usually do a little bit lower of a dose, a lot of times 0.025, or we could go a little bit stronger with 0.05, but typically I don't just jump into 0.1%. At least that tends to be my thing. Again, I talked about this before as well, that when it comes to me, I usually don't really believe in overly drying the skin. I really try not to overly dry the skin. When I try to do it, I try to make sure that we could do this as natural as possible without making things as irritated as possible, if that makes sense. So really, I want to make sure that the healing time and the recovery process is great. We really emphasize moisturizing. But even for patients, when they're coming to us for acne and things like that, I try not to just dry out the skin. So let me see. I think some people on IG are saying that it's a little bit muffled. Let me see how I could fix that. I'll try to see if we get. How's the sound for you guys? Is it sounding kind of muffled here? Let's see here. Edith is saying, what about microneedling? Microneedling is not going to give you much of a result. Hi, Yellow. How's it going? So I'm not sure what is happening with the sound there. So I'll double check to see. Maybe next week I'll try to fix something with that sound situation. Maybe it's something going on. People there are saying it's a little bit muffled there, or like robotic. I assure you I'm not a robot. Definitely not. So it's really me. It's really live. I'm here. It's not AI generated. So you can talk to me, interact with me. It's laggy. Okay, yeah, I'll try to see next week. I'll try to solve that. This is kind of my first time doing a bunch of stuff, a bunch of different platforms. So over the last week, so I learned a few things. So I'll try to figure that out for next week. Hopefully, you guys can still hear me though, and we could go through this a little bit though. Let's see here. What is something that's effective for acne scars that's not expensive? Well, TCA Cross is not expensive. That's very effective for like deep ice pick scars. Reed is saying, is there a way to make these type of scars completely disappear? Well, some of them did completely disappear, but it's tough to go completely, really. Appreciate you, hello. Prod Miguel is saying, I have these type of scars. What do you recommend for them? So what we did was TCA Cross, we did Subcision, and we did Bellafill in this case. Sometimes we do laser if there's thick edges around the scar. In this case, there really weren't, and it was the right call, really. We didn't have to go. I don't go more aggressive. I don't need to go more aggressive. Everybody thinks you're supposed to just go crazy, wild, aggressive. Honestly, anybody goes into this stuff, there'll be people that will tell you you're just supposed to go wild and go aggressive and stuff like that. And it's like, I just don't go that aggressive. It's kind of funny. It's about going in multiple different layers of the skin. It's about working at it really, really carefully and paying attention to the types of scars that you're treating. That's what matters. Hi, Big D. By the way, how's it going? Big D saying, hi, Dr. Qazi. I'm on my second cycle of Accutane. I'll be back in 1 more year, I promise. Awesome, Big D. Look forward to it. That's better for us because just acne's under control. You'll have a better result. Renee Deli saying, I have acne scars and have marriage. I want to fill my scars at least for 1 week, please. Well, I could, I've done that before for patients where I just do filler, hyaluronic acid filler. Honestly, it's so funny. I see people on here, they sometimes come up on my feed too, and it's like, we could get excellent results if we just plumped everybody with filler. Like hyaluronic acid filler, it's not going to last too long, but I could just get a quick, real fast result. And like, there we go, there's the result. And a lot of people do that. A lot of people say this is like, their acne scar treatment. And it's like, where is it a year later? Where is it 2 years later? Where is it 3 years later? And I've been showing you guys that during this time that we've been talking, I started this, by the way, I started these live sessions almost a year ago, I think in October. So I'll have to do like a little anniversary. But I was talking to every guys about so many different subjects, and I've been showing you so many results after results after results, and so many people are like from years ago, and you still see the scars are really, really great, that the skin quality is even better, that everything looks amazing. And like, I don't think anybody showcases that whole journey, that not just like, 6 months out, not just a year out, it's still great. So I think I love that. Let's see here. Renata saying, okay, you mean at least for 1 week, it'll stay, right? Yes, we could get for longer than that. We could do actually hyaluronic acid filler, which will last a little bit longer there. Let's see. Sophia saying, I want to send you my pic. I'm not sure what scars they are. Well, what you could do is actually schedule a consultation with me. Go through my profile and schedule a consultation. I'll be happy to help you out. Let's see here. I know I missed a few things here. Sophia saying, I've had CO2 times 2 and microneedling times 9. No difference. Sorry about that, Sophia, that someone did that multiple times like that. I would not recommend that, honestly, doing microneedling, especially for these kind of scars. So talk to me. There's a lot of things that we could do. Hopefully we can help you out. FM is saying, so is Bellafill equivalent to a liquid implant? No, very different. Bellafill really does trigger your own natural collagen, whereas an implant doesn't do that. So very, very different. That's just silicone. It's just injecting. It's not actually fixing the actual underlying problem. I've run into a lot of problems with silicone before. My partner, she's a plastic surgeon. She's removed that a lot of times. People have done it elsewhere, so a lot of times outside the country. But sometimes you run into problems with that. I don't recommend that. Let's see here. I know I missed a bunch of things here. What did this person have done? This person did Subcision, Bellafill, TCA Cross. This is what it could be. Let's see here. What is something that's effective for acne? Oh, I know I answered that question in row. Effective for acne that's not too expensive. TCA Cross, not too expensive. Take a look. That's actually really effective for deep ice pick scars. Rhea is saying, what do you think of doing Potenza 5 times then proceed to CO2 for rolling and box scars? I would not recommend that at all. Honestly, I would not recommend that at all. I think that radiofrequency microneedling, when you're doing it for scars, you really could run into problems where you get fat atrophy, volume loss. And I'll tell you the reason why. I don't think that it's like everywhere that's the case. Like I could do radiofrequency microneedling when I do Subcision, but how many of these people are doing Subcision when they're doing that stuff? And honestly, I've had patients who've done microneedling, things like that, dozens of times, and they still had terrible tethering inside there. So it did nothing for the tethered scars. Did nothing. Let's see here. Tony Santana saying, hey, Doc, asked this yesterday, but never got an answer, so I wanted to follow up. Is it safe to do Subcision on the temple area? Yeah, I did that for hair. I do it a lot of times. I usually just don't do things with needles over there like Taylor Liberator. Very, very sparingly would I use a needle over in that area. But I do blunt cannula Subcision over there, and we get great results with that still. Shira saying, hi, Dr. Qazi. My skin has improved a lot since my last visit in your clinic. Thank you. Appreciate you, Shira. Thank you so much for coming on. Let's see here. I'm going to go hit a bunch more questions with this. Is he done with this treatment in this photo? No. So I hadn't seen him for a year, actually. So last September is when I saw him. I thought he's doing well in life, everything like that. And then I ended up seeing him again in September now, and he's doing better. So I love that. It's doing much, much better. And you can see significant improvement over here. And really the skin quality is much better, everything like that. I don't have any more updates about verporphin. I've just had zero information still for the last few weeks. Have had no response whatsoever from the FDA regarding our waiver. So just in process. And that's what everybody that goes through this process tells me the same thing. It just takes forever to get a hold of them sometimes. So just waiting in limbo for that one. Can the fourth cure treatment be done on the nose only? Yeah, you could pick the area that you need to do it in. That's absolutely fine. We could absolutely do it that way. Thoughts on fibroblast treatments? I do not recommend that at all. I do a lot with hyperpigmentation. So when I treat patients with their complications, I see that 1 in 1,000 complication, things like that. And it's like a lot of times really, really problematic for patients because especially Fitzpatrick 4 and above can be really problematic. And there's just better options out there than fibroblasts. When do I stop your pigment cream? You can continue doing it up into the treatment, and then we will tell you when you could do it afterwards. Does retinol make fine lines more dry worse in the beginning? Yes, it does. You can actually moisturize. Feel free to moisturize a little bit with the retinol. Dilute it a little bit. For the first few weeks, dilute it. It's going to be fine. It'll end up being okay. You'll get a really still, you'll still ultimately get the effect of the retinol. So it's going to be worth it actually. So consider that. I know I missed a bunch of questions, so I'm going to try to hit everybody's questions, but FM is saying your staff is quite impressive. They're so knowledgeable about the procedures you perform. They really are, honestly, really amazing team. Really are. And it's something that, like, I wanted it so that it's not like that plastic surgery feel that, like, I told you guys before, I talked about this before, that I went to multiple different offices in order to fix my own face, my own scars, things like that. And, I did lasers, all this. So I did so many dermatology offices, all those things. I think derm offices were fine. They were totally fine, medical, clinical. But some of the plastic surgery offices really did make you feel like they're judging you. Like it really felt like that. So I totally didn't want that feel and that look for our office. It was like super important to us that everyone looked like natural. People like talked a certain way to staff. We don't do any of this upselling garbage stuff that people we're doing everywhere. And it was like, that's why we don't push product stuff, anything like that. We literally give you guys Vanity Cream, we give you guys CeraVe, we give you Cetaphil, and I want it that way. I don't want it so that people are like stressed about, like, when they go here that we're gonna now like push a whole bunch of random stuff on you. And it's like the stuff that we're recommending, that's important. Like you saw for this patient, I did not do laser on him because it wasn't needed. So we still had a beautiful result. That's awesome. If I'm saying you need to do it, it's because I really do believe that's how I'm going to get you the best possible result. I want you to really understand that. It's not because of anything else. It's like really, really, we do very well. We're going to be fine in life. I don't need to nickel and dime people. I just want you to have excellent results. I want to do it safely, and I want you to just like really be happy with your skin and feel really a lot more comfortable and confident as you're going around and you're on a date or you're with friends and you're no longer obsessed with the fact that the light may be hitting your scars a certain way, or you may not be able to cover the pigmentation on your face and you're stressed about that and you feel like people are judging you. One of my patients today, she said that people were like calling her left side or something like that because her right side had scars. That's terrible. That's a terrible thing. Just imagine that. Just imagine it. I was like, you need new friends. Really, I don't know if you're on right now, but like that's a terrible thing. You're like, your friends should not be talking like to you like that. But the thing is that people do say that kind of stuff, and it affects people. It really does. It's like it affects people. It affects their mental health, and it's really sad and tragic, actually. That it's sort of this like socially that people think that it's like if they say it with a smile and they joke about it, that you're supposed to just put up with that kind of nonsense. And I think it's it's really, really sick, actually. There's some people that they look at someone who has a problem and they want to actually make fun of that person. And there's other people that see that and they try to help that person or help them rise up. And you should just be able to determine the difference with that. Like you should see what kind of person is this person in front of me. Is this person that kind of person that's trying to put me down? They're like making a joke in my expense? Or are they trying to help me out with these things and make it so that we could do the better? The lighting is problematic. I talked about it before. I really think that like overhead lighting should just be banned sometimes because it's like terrible for people's mental health sometimes. Everything's going well in life and then you suddenly see this like, shoot, like, is that what people think of it? And now imagine like you see those and now like a loser friend, I say loser, but like what I mean is that like just like a person that has no regard for other people. Now a quote unquote friend is telling you that like, oh, look at your scars. Oh, look at that. Look at that. That's so unfortunate. That's so terrible. So get new friends sometimes. Honestly, sometimes maybe it's a blessing that you had this stuff because it means that you could actually maybe cut out some people for your life because some people just aren't good people. I would say that like, 30% of humanity is probably not great. So like, just cut them out. Just like we're gonna talk to like the rest of us, and like just like accept that like there's a whole chunk of people who like actually also enjoy people suffering. They like love it. They feel better about it. The fact that somebody is potentially somebody else has potentially skin problems or some other disorder or something else. They enjoy that. They feel like they're superior now. And it's like, that's like a really sick person. That's the kind of person that you have to be really, really watch out for, actually, because that's the kind of person that's like gets drawn towards fascism and drawn towards xenophobia and everything else, because it's like, that's the kind of guy that like does that. And if you ever wonder, if you look at the comment section, all those people that are mean-spirited people, that's like the kind of person that is. It's like, stay away from that. So in a way, hey, you having scars and you having imperfect skin kind of like helps you like kind of cut certain people out. It's like, this is like your way like of like saying, okay, this person is like that, I'm gonna cut that person out. That's actually pretty good. So maybe it's a good way. The girl who loves says, I literally cried after my appointment. I felt like a wimp, but like, who does that? Wait, what happened here? I feel like I missed something here. I missed the story. Let's see here. The girl who loves teeth says, my doctor looked at me and said, oh, you've had bad acne. Oh man, there's so many on both cheeks. Oh man. And then she said, I had 3 pimples. My acne had gotten so much better and I just started feeling confident. Literally cried after my appointment. Yeah, that's terrible. And she was there. She said, the girl who loves teeth says, I wasn't there for my acne. I was there for my lymph node. That's unbelievable. And actually, honestly, I've witnessed that. I've seen it at med school. I've seen the same type of thing. And it's like, it's so terrible because there's some people that like, they have pain, things like that. And people will be sitting there and like physicians or and like, medical staff will be sitting there judging them for their pain or judging all this stuff. And it's really terrible. Now, like, think about like how terrible that is for someone that they're going through all this whole process. And now somebody's sitting there and like, just like really mocking them or demeaning them and just basically acting like this thing is not really valid now. And it's like, how do you know really what this person is going through? Especially like you have a sickle cell patient here and every inch of their body's inflamed and they're like, people are insulting them about that. So it's terrible. Oh my God, I went to Dr. Azani. He said I was too young and pretty to be dealing with bad skin. That's a curious statement. Steph is saying, what about subcision on plastic surgery level when you actually go in and cut the burned scar tissue? We do that. I showed that yesterday. I showed actually an elliptical excision result. I'll show that again today if you want. I could show that elliptical excision result. Well, we did a few other things, but that's surgical. That's what I did surgical. I can show that right now actually if you want. Let's see. Okay, wait. Let me try to figure out how to hide something. I'm going to try to hide one of these images and show you the other one here in a second. And then I'll show you that surgical elliptical excision here. So here we go. Okay, this is nice. I had another view too. I was trying to pull up, but that's okay. I'll show this one right now. So we did elliptical excision. Basically, we took out the scar and then we made it into a more linear scar. So this is actually 1 month out. Amazing result, 1 month out. I haven't posted because it's pretty early still right now. But you can take a look at this and you can see impressive results that we did in the temple area. We did it over in the cheek area. That's the elliptical excision. We also did ablative CO2 laser, TCA Cross, Taylor Liberator subcision. I did a few things. I also did Bellafill in the temples. But, I mean, 1 month out, that's really, really impressive. And look at where that scar is afterwards. Look at that that wide scar, and look at that. It became more linear. That's really, really nice. That's really nice, right? Like so that's what you can see right there. Glamour is saying, if you want to treat scars, should you wait to do any HA filler or Sculptra for anti-aging purposes? I would probably, it doesn't matter about those, but if it depends on where it's located, I don't want it to be relatively superficial, if that makes sense. Especially for HA filler. Sculptra is fine though. What procedure is this? This is a combination session. This is with Taylor Liberator subcision. This is with Bellafill in the temples. This is with elliptical excision. So I took out the scar. We also did a TCA Cross, and we did a fractional CO2 laser. We did a fractional erbium laser as well. I know I'm missing so many questions. Thank you guys for all the questions. I'm going to try to hit them as I could. Tony is saying, is it possible to have scarless skin after having acne scars? Depends on how superficial it is, to be honest with you, and how many sessions you're willing to do. Audrey is saying, will a CO2 laser untether scars so you don't need to do subcision? No, it's just flat out no. I would challenge anybody who says, like any physician or provider who's claiming that, I want them to prove it, really. Like show it on ultrasound and prove that case, because I do so much subcision with patients who've done multiple sessions of CO2 laser, and there's so many tethered bonds afterwards. And the truth of the matter is that it's an invasive procedure. I try my best really to make sure that I have accomplished the subcision under a single session. I really do. And I don't want you to keep on going through that process. And so people who say you have to do 3, 6 times, it's just not true also. It's not true. It's not true, and they should stop saying that you have to do it so many different times. Maybe in select cases, I'm sure there's some people who do a lot of this and say that's fine. I trust that. That's fine. Because I know that sometimes you would have to, sometimes it's too deep. You want to go through it properly, see how the swelling goes down and do that. That's okay. But it's not true. And to sell these packages of subcision, stuff like that, it makes no sense. I do so much of this and I don't do it that way. So what does that tell us? This was after a single session with subcision with 1 month out. Look at how impressive that improvement is. And it's going to continue to get better. It really was. We put some more Bellafill in him, did some more TCA Cross in him, and it's going to get better. But a lot of that was manual work. This was not just laser stuff. This is with Excision. This is with the laser portion of smoothing down the edges of the scar. That's what you're seeing. This is with the subcision, breaking up the scar tissue. That's the process there. Rayard is saying, since I live in Europe and it's hard for me to travel all the way in the U.S., could you recommend a doctor in Europe? Dr. Emil's a great guy. Why don't you talk to Dr. Emil? He's over in Denmark. Take a look at him. I know that he's somebody who's very caring. So why don't you take a look and see Dr. Emil? Let's see here. Audrey's saying, I'm planning to do subcision with my doctor soon, just a little scared. Well, honestly, I mean, see how many subcisions people do. I think subcision is really it really depends on your technical skills. So how you're doing it is, the way you feel the skin, everything like that, it varies by provider. And people say, well, this guy charges so much, blah, blah, blah. The truth of the matter is that I've actually done subcision on people who've done subcision elsewhere, and they've done subcision multiple times elsewhere. And I go in there and I've completely broken up that scar tissue. And, afterwards, if anybody ever goes in there, they'll see that it's completely smooth. So it's totally different level. It's a totally different level the way I do subcision. And in fact, I really think that the amount of work that's involved, it really could be, a lot more. It's just that I'm trying to keep things as reasonable as possible for everybody. But the truth is that the subcision, just because someone says they do subcision, someone else over here is doing subcision and they're sticking a bunch of needles in someone's skin and they're calling it subcision. Just sticking a bunch of needles and jamming it in there. And that's what their subcision is. It's okay, that's nothing that's impressive right there. That's not that's not truly breaking up the scar tissue that we're talking about. Sure, that's something, I guess, maybe, but I don't think that's really going to be effective, and it sure doesn't sound like it to our patients, that is. Audrey's saying, people on Reddit scare me and said it causes facial sagging, but I think I have a great doctor. Awesome. Audrey, who's your doctor for subcision, by the way? But yeah, I mean, first of all, I think that there was a possibility, and there is a possibility of causing sagging with subcision. I've always felt that there was risk involved, and that's why I tried to maximize it under a single session. Especially if you're using sharper tools, tailor liberators, things like that, or Tulip is another tool that's relatively sharp, kind of fallen out of favor. But those are tools that you could run into more problems with. You could shift fat, and you could actually, especially in the lower part of the face, potentially disrupt certain ligaments, which actually could cause fat herniation afterwards, and that could be what people are concerned with, causing sagging in the future. But there's ways of doing it. Most of what I do is blunt cannula subcision, and then for small localized spots, that's how I do the tailor liberator. I really don't do full field and just break up the scars and just start going to this windshield type approach with a tailor liberator or anything else that's like a sharp tool. I'm really localized and really focused on the areas that are stuck and pulled down. And I think that's what's really important. And if anybody's watching this and does this stuff, wants to take one of my pieces of advice, do that. Because I know, the physicians who have trained with me, they see that, they know that I do it that way. But I think that it's maybe not as super clear when you're watching these videos. It sort of seems like I'm just breaking this up and doing that. I actually don't use much force either. I don't believe in doing much force. I'm actually just very slow. Just keep on working on it, and just wait and wait and wait. And then I'll do it, and just keep on working at the spot. If it breaks up quickly, great. But I will just keep on making sure that I've and until it's done, it's not done. I feel like, well, I should say, somebody told me before, actually, say, if you think you're done, you're not done. And that really stuck with me. It's if you think you're done with something, you're not done with it. It's like keep on looking, double check, triple check, and just quadruple check. And just like this is like the patient. And 60% of our patients come from out of state. I want to make sure it's a slam dunk result, and that we get that result, and so you could be really happy. And if I happen to run into you, as I did for a patient a few months ago, I ran into a patient at a wedding in Chicago who I hadn't seen in a while. And it's like, it's really nice that, I'm running into someone and like, we are totally great. Everything's awesome. It's like your skin looked amazing. So it's like, I love that. It's like, feels really, really good. So even if you're somewhere out of state, like, I'm around, and like, who knows, I could run into you at a wedding, something like that. And like, I want you to feel really comfortable and confident. I want to look at this and think I did a really good job. Their scars look really, really good. It's like, and makeup doesn't cover up scars. It's like, it's still like, and like, there's, it's like a lot of times it's like makes it worse sometimes. It's like the makeup actually, especially certain kinds of scars, like it can make it look a lot worse. So it's like, you look at it, it's like, yeah, that looks really good. Feels good knowing that, that I did that. It's like, that's really good. So that's what I like to feel. Bo Kimmy is saying, realistically, how many sessions do you need for your skin to be back to normal? It depends, honestly. Everyone's collagen response is very different. It could take several sessions, especially for deep scars. Ice pick scars, it could take 4 to 6 sessions of TCA Cross a lot of times. Let's see here. I know I missed a bunch of stuff here. I'm going to be finished right now, but I is saying Sculptra and Subcision. What do you think? It's not good for a combo in one session. I think it's fine. The way I do Sculptra, typically when I do Subcision, though, as I go deep down to the bone, I typically don't do as much, just dilute in the solution for the Subcision, because I get worried that potentially could go elsewhere. I want it to be really, really precise, not change anybody's natural smile or anatomy, things like that. I'm really, really focused on that. Can you show results of more shallow acne scars? I'll try to do that maybe next week or so. All right, guys, thanks so much. Appreciate everybody that came on tonight. I know I missed some questions. Hopefully I have a few more that you guys could ask me next week. I'm going to try to solve the way I could stream on here, because I heard that there was a bit of a lag.